We continue with the conversation on the NHI Bill, which will be signed into law tomorrow by the President. We're joined by Progressive Health Forum founding convener, Dr. Aslam Dasoo. Doctor, good evening and thank you very much for your time. So, broadly speaking, very few seem to be opposed to the NHI or the principle of universal health coverage. They seem to be opposed to the bill in its current form, or perhaps the timing of the signing, given the current state of our health system. Just your reaction to the announcement that the President will be signing this particular bill.
Thank you for inviting me. Look, this is a formality in a long process, so we're not particularly exercised by the fact of the signing. You know, it's passed through Parliament. The problem with this bill is that, in our view, it's entirely misconceived. And I think that arises from the fact that we have a health system in the country that this bill or this act, you know, once it's signed, will not be able to actually change in any meaningful way in the short term, medium term, and perhaps not even in the long term. And the reasons for these are myriad, and, you know, we won't have time to go through all the various technical reasons. But what may help is just to give you a brief context. South Africa has two very important health system. It has the public health system and the private health system. Now, in 1994, we understood very clearly that our public health system had to be integrated from the ravages of apartheid. But what we discovered was that it's very widely distributed, and it's actually had all the components for a very good national health service, world class, in fact, with services from primary to quaternary care. And in the first administration of the democratic order, this was recognized, the integration happened, and the public health system was one that I think could hold its own among any other public health systems in the world. And what we did was to actually plug any gaps. So, example, you know, by 1999, we had built 1,000 primary healthcare centers, bringing healthcare for the first time to within 10 kilometers of everyone's doorstep. And this gave effect in a major way to the constitutional entitlement of universal access to healthcare, which is far superior to what the NHI is based on, which is universal health coverage, which is a UN approach to things. And the policy flowed out until 2007, 2008, when it was abruptly stopped, where the regulation of the private sector was stopped and public sector development kind of fell away with the advent of the Zuma administration and the push by, I think, the allies on the left of the ANC, who did not want private healthcare at all and just gave us an unresearched, uncosted new health policy in a couple of slides, which they have spent the last 15 years trying to retrofit, and which doesn't really make much sense. So I'm disappointed that the President feels it necessary to sign the bill, given that there have been over 350,000 submissions made, which they didn't go through, and they didn't give consideration to. And so obviously this is a bit of a...
Oh, unfortunately, we've lost Dr. Dasoo there. Very important conversation that we're having, but the gist of it there has been expressed with him just stating that, at least as the Progressive Health Forum, they are quite disappointed in the President that there were a number of submissions of many people opposing this. But at the heart of it, what we're hearing is that many South Africans are pro-universal coverage, but the biggest problem would be the timing thereof, that if we look at our current health system, is it at a place where you can have a number of South Africans all accessing quality health care, that if you're looking at the public system, many say you need to bring it to the level of the private healthcare system so that people would then be able, that if we have government as the sole buyer of health services, you can be directed to any hospital, to any clinic, and you would get the same kind of service. Doctor, I hope you can hear me now. I just wanted to talk about this sentiment for many that at this point, what needed to happen first was perhaps to deal with the infrastructure issues, bring the public healthcare system to the level of the private. Then beyond that, you bring in the sole buyer of services, which will become government. That here, when I am directed as a person perhaps living in the township that used to have a medical aid, if I'm directed to a clinic in my township, I'm very fine with that because now that particular clinic's infrastructure has been brought to the level similar to that of a private clinic.
Thank you for that description. I think you're absolutely correct. There's a tragedy here, I think, unfolding, because had the original plan that allowed for universal access to care been completed, by 2010, 2012, we would have had exactly that kind of system, an integrated service where there would be a private component, properly regulated, and a public service which is as you've just described. Unfortunately, that was stillborn. And then we had this NHI. And for 15 years, they've been trying to retrofit this NHI, and it's now given us this bill. And I can assure you that it is unlikely, even in the long term, to give us the kind of system you have just described. Mm-hmm. And I think what we have to do is actually consider the following, that we must immediately, if 90% of the population is dependent on a public health system that is quite degraded, but if 90% of the population depends on it as a system of first and ultimate resort, surely a sensible government would spend 90% of its time fixing it, rehabilitating it, maintaining it, and increasing its capacity for a growing population. It is a world-class resource that we've let go, and in fact, it's a national treasure that we should not let get so degraded. The private sector, on the other hand, in these last 15 years, has grown tremendously because it's unregulated. Mm-hmm. The health market inquiry that was chaired by former Justice Sandile Ngcobo, or former Chief Justice, made it clear that the government had failed to regulate, and here are the steps that it needs to take to properly regulate the private sector so that it wouldn't be that expensive, it wouldn't draw on public resources, whenever it felt like. It couldn't just toss you out into the public service when your benefits ran out or anything of the sort. But they've ignored that as well. So for the last 15 years, things have just gotten worse. Now they're giving us this. And here's the real upshot. They're saying it will take up to 20 years to get this. So the last 15 years of waste, plus another 20 years. What are we telling South Africans? The 80 to 90% of South Africans.
Doctor, it honestly remains a very interesting conversation. I wish we had enough time to just get into the funding model thereof, because it's another contentious element of this, because many are arguing, particularly economists, that with our tax base right now, can you honestly fund? That if you're going to have roughly 24 million taxpayers being the ones to fund 60, and in all truth, you've got really 5 million taxpayers that would be the ones that at least contribute a significant amount to then fund the 60 million. So it's quite an interesting conversation to have. Hopefully we will have economists as well. Just give us the take on around, or at least around, the funding thereof. But that was Progressive Health Forum founding convener, Dr. Aslam, speaking to us on this very important conversation.